Hi, I'm Dan Holscher with Senior Mark, and if you've joined us today, it's because it's that time of year again. It's the Medicare annual enrollment period. The enrollment period this year runs from October 15th to December 7th. The reason you're here is because you have a prescription drug plan. This is going to be your time to review your drug plan and make sure that it's going to meet your needs for the coming year. One question we get a lot is why review or reshop your drug plan? A lot of people just take the easy road and say, well, I was happy with my drug plan last year, so can't I just continue it into the new year? Truth be told, yes, you can do that. However, the plans change, and it's important that you review your plan. In fact, we highly recommend that you do that. Premiums change. In fact, over the years, we've seen plans go from $15 premium a month to $40 the next year and up over $100 a month the following year. So you want to pay attention to your premiums. Your deductibles may change. Your plan may not have had a deductible last year, and for 2026, they might add a deductible. The copays that you pay for your prescriptions change. The levels that your copay is in. So sometimes you might have a generic 1 year, and the company may move that from a generic tier into a brand tier. So you definitely want to pay attention to that also. Formularies change. Formulary is the list of medications that the prescription drug plan covers. So you want to pay attention, because just because your drug was covered last year doesn't automatically mean it's going to be covered for the new year. And finally, in rare cases, plans may be discontinued. So if your plan is discontinued, sometimes plans will map you to a new plan automatically. Other times it's going to be up to you to get a new plan. Otherwise, you may be stuck without one for the following year. So what do you need to do for this year? You want to look out for your annual notice of change. It's going to be mailed out in September sometime, and that's going to be your notice from your drug plan that's going to tell you all the changes that your plan is going to have for the coming year. Usually those changes will be reflected in the first couple pages. So if you want to kind of review it on your own, you want to take time to review, has your premium changed? You know, it could have went from $15 to $100. We can't make any promises. Are your medications still covered? Like I said, if they give you a formulary book, you can kind of spot check your medications and see if they're going to be still covered for the new year and that they're in the same tier. If it went to a higher tier, you want to make sure you know what that copay is for that tier. And finally, have your copays and deductibles increased? Even though you might have been a tier 3 brand name, that copay level might have went from $40 to $70. So you want to pay attention to that. If you do need help, we're going to recommend that you contact OSHIP. And OSHIP is a volunteer arm of the Ohio Department of Insurance. And when you call them, they will help you shop your drug plan. When you do call, you just want to make sure that you have your prescription list ready for them. And you want to make sure that you let them know that you only want to shop your drug plan. So tell them you want to shop your drug plan only. OSHIP stands for the Ohio Senior Health Insurance Information Program. Like I said, it's a volunteer organization. They do a wonderful job at helping people. Their 800 number is 800-686-1578. And you can call them beginning October 1st, but they won't be able to make any changes until October 15th. So you may want to just wait until October 15th to contact them. Just remember, as of December 7th, if you haven't changed your plan, you're going to be locked into the same plan you had for the new year. If you feel like you'd prefer to meet someone face-to-face, you can contact the local OSHIP volunteer, Trina Childs, in Auglaize County. Her phone number is 419-394-8252. Now, during this time of year, you need to keep your eyes open and be aware, because there's going to be a lot of sales practices that are less than ethical. So you want to be careful. There's going to be fraudsters, hackers that are trying to get your information. Do not give your personal information to anyone calling you. Scammers are very good at knowing possibly where you bank. They might even know a local employee at a bank. So even if your bank calls you and it's someone that you think you know, don't give out personal information. So just make that a rule of thumb. Don't ever do that. Do not do business over the phone with somebody you do not know. This time of year, there's going to be a lot of Medicare phone calls you're going to get. And they're going to be talking about Medicare benefits you're missing out on, all kinds of things. So do not do business over the phone. Do not fall for the promise of getting Medicare benefits you're missing out on. This is a sales ploy that salespeople are using to make you think you're missing out on some traditional Medicare benefits. When they are talking to you about ancillary benefits you're missing out on, they're talking about a whole nother Medicare plan. A lot of times they're Medicare Advantage plans. You may get that benefit, but they are also changing your underlying medical benefits. And sometimes that's a dramatic change. So you may be getting a $150 grocery card and potentially giving up $5,000 to $6,000 in medical benefits every year. Finally, do work with a local agent you can trust. Whether that's our agency or somebody else that you work with, we highly recommend you work with them versus somebody over the phone, because we've had a lot of experience with clients who got a phone call, thought they were signing up for an extra benefit they were missing out on, only to find out after it was too late that they had a whole different health plan. Like always, we appreciate your business year to year. If you have questions or you do need help, get a hold of us. We'd be happy to help you. Our phone number here is 937-492-8800. Thanks for joining us.